is that affects us as a people. And on this week's episode, we're discussing and focusing on health. Today is World Hepatitis Day, and that's what we're doing. I have some experts in the that set this issue. My name is Gospel Amalia Minfo. I have in the building some, like I said before, beginner, exciting day. I have pharmacist, OKINEDO. Sir, you're welcome.
Thank you very much for having me.
And also, I have another colleague of his, who's also a professional in the health sector, also a pharmacist. Let him by himself. All those business. Sir, welcome.
Thank you very much. My pleasure to be here. The name is GREDSONIL.
Now, looking at health, the words are getting us why so much focus? Why should we want to look at that? Pharmacists, why the awareness? Why the sensitization?
Thank you very much for that. Maybe the question is why not celebrate World Hepatitis Day? So every year, 28th of every year of July, every year, the world commemorates World Hepatitis Day. The reason, is to raise awareness on the need for everyone to get involved in hepatitis. To talk about hepatitis A, what this hepatitis A is. So that is set aside. And it's symbolic because it is the day the person who discovered viral hepatitis B was born. So that's totally his birthday. So on the 28th of July, Dr. Barry Bloomberg lives now. So in order for us to remarkable contribution to body of knowledge to viral hepatitis. So that day set aside by the World Health Organization to mark to commemorate hepatitis globally, and that's the reason why we are celebrating it.
All right, thank you very much for talking about the person that discovered this.
All right. Thank you very much. I'll just take a cue from what my colleague has just said. Um, yes, every July 28th of every year, we commemorate the Hepatitis Day. And for each of these years, there's usually a charge. Notably for last year, it was we are not waiting, we are taking action, informing people that we intend to tackle this issue of viral hepatitis head on. But this year, we've come back to also inform people that, yes, it is time for action. That action we promised last year, we are now taking the action. This is the time for the action. And all these charges are targeted at getting viral hepatitis to elimination by the year 2030 as have been planned by the WHO. It's very pertinent that we do everything necessary, everything within our powers to promote awareness, to promote testing, to promote treatment, vaccination, all aimed at getting this set goal of viral hepatitis B elimination by 2030. Thank you.
When people hear that
So people really shouldn't be scared. Rather, we should be worried that enough actions are not really taken in this regard to curb the spread of the virus. Now, we'll just now, maybe we should start looking at what is really this virus, what is hepatitis in the first place. Okay, so hepatitis simply means inflammation of the liver. That's swelling of the liver. So when the liver swells, it's called hepatitis. And that can be due to some causative factors. Viruses are one of the causes of the swelling of the liver. Okay. Alcohol can also swell the liver. Okay. Some other medications can also swell the liver. So, but we'll just narrow our discussion to the viral aspect of it. So when we hear viral hepatitis, we mean inflammation of the liver as a result of either hepatitis A or hepatitis B or hepatitis C or D or E. So these are the major causes of these are the viral hepatitis that we have at the moment. What is so special or what is very significant now? And then tying it to what hepatitis is. Over the years, viral hepatitis has not really gained that traction. It has not been discussed in public space as much as like the HIV we talked about, as we discussed. So today is usually that day that we heighten the awareness. Use several platforms like what we are doing now, using this platform to educate the public that there's something called viral hepatitis. And the three that we are really focusing on that are, we call them viral hepatitis or global public health concern. They are of global public health concern because the mortality they cause is very, very high. Okay? So reports from the WHO recently now, puts it now that the deaths from viral hepatitis are rising. From 2019 from 1.1 to now 1.3 million in 2022. And that's a huge one. So for hepatitis B, C, and D, these are of public health concern for us. And that's why we are really, raising the awareness to ensure that people get to know about hepatitis. I'm sure if you walked along the street and asked like 10 persons if they've heard of HIV, they're likely to tell you yes. But when you ask these same people, have you heard of hepatitis? A lot of them want to ask again, what is that? So the awareness is quite, and that's why we are now raising. So for B, C, and D, these are of serious public health concern. And maybe we can be talking as we go on, talk about how B, C, D, and possibly the A and E, how they are spread. Maybe as we go on, we can talk more about that. Thank you very much.
So when you talk about B, C, how do you differentiate between hepatitis A, hepatitis B, hepatitis C? Do you have to why is it? Yeah, go ahead.
So well, looking at A to E now, right? Now, hepatitis A and hepatitis E, in terms of mode of transmission, they are similar. They are what we call fecal oral. One can pass this hepatitis A and E via the fecal oral. So, literally, when someone gets hepatitis A or hepatitis E, you see, you are looking at the hygiene, really. Just as you have the cholera. The cholera heightens when the hygiene level becomes a challenge. The same way. So that's via food or polyhandled food substance. But for B, C, and D, these are bloodborne, just as we have for HIV. So that's why we do B, C, D, and the HIV. But the same way, when we know HIV, the same way HIV is fast. Transmitted. That's the same. Exactly the same way viral hepatitis is spread. So anything that's facilitates blood exchange, do a infected person and another one who's not infected. transmission can happen in that regard. And for us here in Africa, you know,
Probably those are ways of transmission. This mother to child accounts for about 90% of transmission. Very well to you.
Yeah, for hepatitis C, mostly is common. Like in Nigeria, it's mostly common among those who use drugs, use injections, drugs, use that, and all that. Okay, so but that's one of the reasons why we are doing this awareness to let people know that the transmission hepatitis is really real, and statistics from the WHO say that one person dies to hepatitis B, hepatitis C, so one person dies every 30 seconds. So imagine the time we have spent since this program began, the number of persons that have died. Okay, so every 30 seconds one person dies. This is a big challenge. So that is why we say viral hepatitis B, C, and D are of global public health importance. Because the number of persons that die as a result of these viruses are quite huge. And we must take necessary steps to ensure that we prevent this. Thank you very much.
All right, thank you, pharmacist OKINEDO. You're talking about the mode of drugs. How do you contact this?
Okay.
Waterborne, airborne. Just let us know how the mode of contact. How could somebody, when you say that somebody has this thing, what are the
Okay, quite simple. Like pharmacist Chris rightly pointed out earlier, the A and E, they are mostly transmitted via fecal oral fluids. What like fecal oral? When we say fecal oral, we're actually talking about hygiene, personal hygiene. You buy food, you don't wash, you are contaminated, you consume, you eat, you go to use the restroom, you touch certain items that are contaminated, you don't wash your hand properly. So it just revolves around hygiene. That is for A and E. But for B, C, and D, which we have also emphasized on of global health concern, these ones are mostly passed. They're the same way you know your HIV virus to be passed. But mostly for hepatitis B, it's mostly passed from mother to child during childhood. That is why we at the Hepatitis Advocacy Foundation, we're actually promoting the prevention of the mother-to-child transmission via testing, any testing, treatment, vaccination when necessary to prevent the virus from passing from the mother to the child. Now, like we all know, over 90% of viral hepatitis B transmission is via the mother-to-child transmission route. So if you can get it right at that stage, of course you would have scored a whole lot in elimination of the viral hepatitis. So for us at our foundation, we are not just talking, we are taking actions. And our actions include this bigger awareness. We also have a host of community pharmacists that are working with us, sharing this same awareness to their patients as they're working. And of course, we have partnerships that have also been very, very productive for us. I will go into that much later. But as for the transmission, just know that the B, C, and D, they are related. We can relate them to the same way HIV/AIDS is transmitted, virus is transmitted. But for A and E, they can oral route, personal hygiene. Thank you.
Yes, sir.
Yeah, talking about, okay, you want to add?
So just to add to that,
just visualize, just bring your knowledge about HIV, all you know about HIV. That is what hepatitis B and C are. And then, as in rightly talk about mother to child, which is very important. Now, the age at which a person is exposed to the virus
now determines whether this person will develop or chronic viral infection. No, chronic, I mean, when one is exposed to the virus, the immune system naturally will respond, right? So when this response is within 6 months and the immune system is able to clear off the virus, that's acute. The person gets well, right? But if this response continues and then now it goes beyond 6 months, so then we're now looking at what we call a chronic viral infection. Okay, and that chronic is lifelong, really. So the age is very important. If a child, now only one out of every 10 children born to a positive mother is likely to escape. So which means if you have 10 women who are positive for hepatitis B, and then they are pregnant, and nothing is done to prevent transmission, these 10 women, out of these 10, 9 out of these 10 women will likely pass this virus to their newborn. And that's why how serious this is. So for adults can easily, the risk of transmission for adults is much lower because understandably a child born, has very poor immunity level. Okay, so that's why our focus really is to ensure that we stop the transmission. So no wonder we have high burden of hepatitis. Now let me paint the picture now. Nigeria has the highest burden of hepatitis in Africa. We are the most populous black nation, yes, okay? And so the prevalence for hepatitis B alone in Nigeria is put at 8.1%. For C, it's 1.1%. Now, when you put that together, you realize that Nigeria has between 17 to 20 million persons who are living with hepatitis. Now, less than 10% are aware of this. And even less than 1% are on treatment. So let's bring it down to Delta State and let's see how this is the picture. Delta States alone, very recently working with the Ministry of Health, now we got a picture of what the prevalence, the burden of viral hepatitis is in the Delta State. Delta State has a prevalence of 8% for B and 5% for C. Now, when we put that in context, looking at the population of Delta State of 6.8 million, right? So it means we have not less than 884,000 persons who are living with hepatitis B or C or co-infected with B and C in Delta State. So how many persons are aware of this? So if we have this number just slightly below 1 million persons in Delta State who are living with hepatitis, how many are aware? And then how many are really on treatment? So you see the picture. And then one issue around not being aware of one's heart disease, this person carries on, and at the end is liver cancer because hepatitis is the major cause of liver cancer. So if we want to prevent liver cancer, it means we have to now start preventing further transmission, and also those who are already infected, we must ensure that they are well on treatment. So once we do this, then we can now be sure that we are on the path to the viral hepatitis. So you can see why it's very important that we talk about viral hepatitis. And we will continue to talk about that. As we go on, we'll talk about some of the interventions, some of the steps that are some of the activities that are happening surrounding viral hepatitis. Thank you very much.
Okay, thank you very much. In case you are just joining us, the program is You and Your Health. And we're looking at World Hepatitis Day, which is celebrated or marked on the 28th of July every year. And I've had some guests in the studio who are doing justice. Now, how show stigmatization and every other challenge you are having, you know, being addressed.
Okay, so let me just quickly, my program manager will respond to, but let me just quickly say that we would like to appreciate His Excellency, the Governor of Delta State. You know, last year, November, where we came together with the Ministry of Health, and also a representative from the Hepatitis B Foundation we invited to Delta State, where we paid Her Excellency a courtesy and also an advocacy visit, you know, as regards viral hepatitis. It was the following day that we saw that the governor had directed that all pregnant women from viral hepatitis B and C under the health insurance scheme. And you know, that's the first state to have that kind of policy on ground. And that's why we are saying thank you to His Excellency for doing that. You know, it gladdens our heart when we saw that the response was very swift. I've never seen that kind of speedy response, you know, from government where you demand something and it happens for us. But again, we want to say that it's not just screening, really. So it's screening. Pregnant women now, as it stands now, pregnant women now can now access screening for hepatitis B and C free of charge. So why is screening going on? We are seeing women who are positive. So it goes beyond screening. We really need to now start. So when you identify them as positive, what do we do with them? Okay, so in terms of response from the state, we've really been seeing that kind of response. I thank the Honorable Commissioner too for this intervention. So Delta State is really responding well on track now. So we just want more to be done. As I mentioned, screening people for hepatitis is not enough. We must also go beyond screening to start looking at treatments, which is one aspect that is lacking at the moment. And so, in fact, my programs manager will be talking a little bit about it. An initiative that we, as our foundation, decided to fill that up. But the whole essence of that initiative is actually to demonstrate to the government that this is working. And this is a good investment for any government. Okay? It's not a wasted investment. Investing in that is not a wasted investment. It is to secure a health. Imagine a workforce. Now, let's look at this for instance. Now, the prevalence, as we said, is most of hepatitis B and C is 13% put together, right? Now, if we now have a workforce, let's translate that to the workforce of Delta State. 13% of the workforce have hepatitis B, for instance, or B and C. Imagine the productivity level will drop because persons who are having hepatitis and they are not well looked after, we don't expect to have good productivity outcome in that instance because they are now at risk of liver cancer. Many will die of liver cancer. So it's not a wasted investment. I mean, the programs manager will talk a bit about how we are filling that gap in terms of access to medication.
All right, so without wasting much time, this is a program, an initiative I'm so enthusiastic speaking about. It gladdens me, and it's also a motivating step. Now, from the foundation, the HAF, Hepatitis Advocacy Foundation, with very active support from the Hepatitis B Foundation in the United States of America, we have been able to start an initiative we call the F-led B+ access. What this entails is that these medications are gotten subsidized. And you know what I say subsidized, you know what I mean by that? I mean seriously subsidized. for people living with viral hepatitis B, people who are on medication, but that the cost of medication has become a burden to them. Now, what this program has actually done so far is that we have been able to get people who initially either derailed from their treatment because of the cost, or people that did not even bother to start because of the cost of medications. I'll just bring it closer home. Um, a month's pack of the medication currently goes for about 16 to 18,000 naira. But
through this initiative, it now comes to the user, that's the patient, at the rate of only 6,000 naira. That is a very major step, very, very major step. You won't get it at this rate anywhere in the country, except it is subsidized. Now, why we took this initiative was to let the government, like my colleague rightly mentioned, to let the government know that, yes, this thing is doing, it is working. Imagine what a foundation of less than 50 persons can pull off. Just oppose it to what the government of a state can actually do. Now, we've been talking, we've been advocating, now we've taken the initiative to now start something that people will see, the government can see. And I'm very glad that even some government workers are also benefiting from this initiative. So they will also go back and tell them that, yes, this thing they are saying is true. They are not just mouthing it. It's something that they have been doing. It's practical. It's practical. So, and we're also hoping that in the coming months, that the government will also key into this initiative to expand it. Because if we go by the maxim, health is wealth, we can also say that a healthy nation is a wealthy nation. Now, if you want people to be very productive, you take care of their health. When they are healthy, they will give you more. So, actually also appealing, we started making such moves that the government, Delta State, state government, also key into this. I trust they will do that. I know Delta State will not slack. The government does not slack in terms of this, all these initiatives. Now, we are hoping that in the next few months, the government of Delta State, through the Ministry of Health, will also key into this initiative, expand it, so that more persons can benefit from this initiative. Now, currently, we have less than 30 persons benefiting from this, but we're hoping that in the next 6 months, it should have been expanded to up to 500 persons benefiting from this initiative, or even more. Thank you very much. Okay, so we are hoping that in collaboration with the state government, the cost of this medication will also be subsidized even further. Currently, it's 6,000 from 18,000. Imagine the situation where it is just about 4,000 naira. You know what that will mean for the users. And it's imperative to note that in our last visit to the contributory commission, where we met with the DG, we also emphasized on this. We also informed them about this our initiative. They were very excited. And I wouldn't want to preempt anything, but I know for sure that if the government comes in, these medications are subsidized further, then of course there's also a possibility that it can be fully covered by the health insurance. But I'm not going to preempt anybody. But I'm very confident that that can be done if the medication, the cost of medication, comes even below that 6,000 naira. At the moment, I know there are some states that would want this initiative in their own state. But we have to Deltas. We started this foundation from Delta State. All our advocacy we started from Delta State. So we also want Deltas to also benefit first before they can expand to other states. Of course, we're not limited to Delta State. The other person's sister foundations are also doing similar things in other states, which is a very good one because say cooperation in our axon, cooperation I mean.
Look right for me.
We're doing our own from Delta State. The other persons are doing from Akwa Ibom, Edo State, and other states. Before you know it, it's a goal for Nigeria because the goal actually is for Nigeria, not just Delta State, to be free from viral hepatitis by the year 2030. But we have to start from our small kitchen before we expand to the reception. Thank you very much.
Okay, now the next question will be while we wrap up this program is hepatitis. Is it a death sentence, is it curable? How do we manage it?
So, now we need to be clear with where when someone says, I have hepatitis, we need
Because
to,
there was a situation where somebody was sacked because he had that ailment. It's as bad as that. So, is it curable? Where are we? Can it be managed? What is the issue?
So when I hear I have hepatitis, the next thing I always want to ask, which is it hepatitis B? Is it hepatitis C? Okay, let's focus on those two. Now for hepatitis B is lifelong. It is not curable, but there are medications to well manage this to prevent liver cancer. For hepatitis C is curable, but hepatitis C does not have vaccines. Okay, B has vaccine. That's why when we say protect yourself by vaccination, we're actually talking about getting vaccinated for hepatitis B to protect yourself from the hepatitis B. So for B has vaccines and B is not curable, but can be well managed. But C, not vaccine but curable. But the challenge here is that these two, the medications are expensive. Okay, now usually for hepatitis C, the cure, once you place the person on medication, we look at 3 months. Within 3 months, this person, about 98% of persons who are placed on treatments for 3 months will get cured. Okay, but maybe like 2% may not be able to completely achieve what we call sustained virological response. So what we do is we repeat that course of treatment for the next 3 months and they will be cured. Okay, so treatments are available for cure for hepatitis C, well effective, but cost has been a major problem. Maybe I would like to talk a little bit about this issue of access to medication. You know, for hepatitis B, or rather let's look at hepatitis C, you know that it takes on the average about 100,000 naira for 1 month for a person who wants to get cured. So it will take like 300,000 naira for just the medication. We're not talking about the cost of viral load, okay, the other diagnostics, abdominal ultrasound scan and all that. So let's say on the average 500,000 naira, that's what it will take to cure one person of hepatitis C for 3 months. So what if this person falls amongst the about 2% that will need a repeat of this treatment? So we're looking at slightly below 1 million naira or 1 million naira if that is the case. Okay, so it's quite expensive. That's why health insurance we can now design health insurance programs to be able to cater for this kind of ailment. Now for B, because B is lifelong, imagine a person taking medication, buying 16,000, 19,000, 20,000 naira every month. How much? And this has to continue for the rest of the person's life. And we understand the volatility of our exchange rate now, the cost of things, hitting the rooftop. So it's likely to even extend further. And that's why we looked at it and said, no, this can't continue. We have to fill in this gap. While we are calling on the government, we are also not waiting. That's why the theme for this year, it's time for action. We have started taking the action. Maybe for us, it is time for more action. Okay, taking the actions to ensure that we really, take the lead. Ensure that people who are living with viral hepatitis will not have to be deprived of the right treatment. So that's why we are now bringing this initiative we call the Help Med Access Plus to help to crash the price for people. We access this medication at global access price, bring it, and then patients just pay for the cost of it. Okay, so that way instead of paying the 16,000, buying at 16,500, we can now be buying at 6,000 naira currently. That's where we are. Okay.
Because of time, your final message.
So my final message would be,
1 minute.
so first one is to the state government. Yes, we are also appealing. We're calling on His Excellency to please. We need more investment in viral hepatitis so that we can prevent people from slipping into liver cancer. And to people who are living with viral hepatitis, that's not the end of the road. It is the beginning of another sweet journey.
Okay. Folks,
Thank
your
you.
final
My
word.
final word is to the people, not to the government this time around. Try by all means to know your status. Testing is the very first step in eliminating viral hepatitis. Know your status. If you are positive, try as much as possible to get vaccinated for hepatitis B. Then if you are negative, try to get vaccinated. If you are positive, visit the nearest available medical center or pharmacy or any health experts and discuss how to commence your medications, your treatment with them to prevent liver cancer. Thank you very much.
All right, to prevent liver cancer, I know, no doubt you must have been enlightened, on the issue, the focus, the hepatitis, viral hepatitis, why you should, first of all, know your status. I think that is the thing. Know your status. Find out what you should do and the necessary things in order to, take care of yourself. I'm sure that you must have, enjoyed this program. If you did, is it, just before we call it a day, is it possible to have or know the centers where someone can have all this
Screening.
screening first?
Okay, so like tomorrow we'll be working in collaboration with the State Ministry of Health. Okay, we organize a road walk, and also free screening, and that screening will be happening at the Professor Chike Dozen Secretariat. So we are calling on everyone within the Asaba metropolis to avail themselves. Come and get screened for free. You're not paying. It's free of charge. Free of charge. Item 7 fee still join self.
So don't forget to, for those that don't know, State Secretariat.
Yes, State Secretariat. Yeah, Bangida. So,
All right, thank you for your time. Join us same time, same platform next week. My name is Gospel Amalian, your host. Goodbye.